I got involved when I heard Dr. Melita Gordon, who's a gastroenterologist at Liverpool School of Tropical Medicine, and she did a presentation at the British Society of Gastroenterology back in 2012, and she described her time when she worked in Malawi for 2 years, identifying a great need for endoscopic services. That's due to the high incidence of GI bleeding from schistosomiasis-related infection, and also the very high incidence of esophageal cancer in Malawi. And the services at that time were very poor and very scant, and she had this vision to provide endoscopic services to Malawi and other parts of East Africa. The training we've delivered to Malawi clinicians, both myself and my colleagues in the UK, have enabled us to train 16 local clinicians in endoscopy, many of them in banding of varices for bleeding and also stent insertion. We've also delivered the equipment, and the nurses have been trained, and as I said, several of them have been trained in trainer-trainers courses to train the locals thereafter. With regard to the outcomes, we know that there's been a 400% rise in number of endoscopies and number of therapeutic endoscopies in the main cities, in Blantyre, Lilongwe and Mzuzu, and there's been an objective and quantified reduction in mortality if you come in with gastrointestinal bleeding in Lilongwe. My first trip out there, I took annual leave, and it was funded by a Tropical Health and Education Trust grant. Thereafter, and I realised this was a sustainable approach to train the locals, I was lucky enough to get funding from the Royal College here in Glasgow to facilitate the travel and accommodation when there. I was also very fortunate that Greater Glasgow and Clyde Health Board allowed me sabbatical leave, a week, a year for the next 4 years, to enable me to have the time to undertake the training visits. I found it very beneficial and helpful to me myself with regard to the experience. I think when you get to a certain age and experience, it is very useful to go and try something different as a challenge. And when I heard this initially, I thought this is something I really wanted to get involved with. And I think it has been very helpful to me. It's not a one-way street. We benefit and learn from clinicians over there and see the situation they're working in a difficult environment. And I think when I come back, I feel re-energized and I have more passion in my work, having experienced the sort of work that is done there in Malawi.